So, hey
Okay.
guys, welcome back to our session of Understanding Bipolar with Dr. Alok Kumar. He is also known as the Bipolar Man.
Hi guys. Hi Anmol. I hope you are doing better.
Yeah. Um,
Eh, Thank you for inviting me again, and it's very
oh,
pleasurable.
it's my pleasure to have you here. And today we are
Thank
going
you.
to, yeah, so today we are going to discuss about the treatment of bipolar. Okay. The psychiatrist role in the treatment and the psychologist role in the treatment of bipolar. Let's start with psychiatrist role. And before we start, let me tell you about who is psychiatrist and who is psychologist. So basically, psychiatrist is a person who can prescribe medicines because he or she do his specialization in medicines. Okay, and psychologist is a person who do his or her specialization in therapies, in counseling. Okay, there is only one difference in both of them, and that is that a psychiatrist is like a psychiatrist can prescribe you medicine because they have the specialization in that, and a psychologist cannot prescribe you medicine. Okay, so let's talk about medicines, how much they are important for a person who is suffering from bipolar, and what sort of medicines do a psychiatrist prescribe to a person who is having bipolar. So, Dr. Alok Kumar.
Yes. I first of all, let me tell you something that I'm in hypomanic phase. I might do some type of mistake, so please forgive me for that. And secondly, there are a lot of medicines which are given for depression and anxiety, and there are so many things inside bipolar that suppose you're hypersexual or something like that. So doctor will prescribe you everything on your symptom. So please don't take medicine unless and until your doctor haven't told you. Uh, that's I am taking currently 8 pills, 4 in the morning and 4 at night. Okay, so the main medicine is lithium carbonate. So I will tell you something about it. And rest, I won't be telling you anything because it might help harm you because without consulting physician. I'm not saying that lithium is not dangerous. So you should not take the lithium also unless and until your doctor prescribes it.
Yeah,
Lithium,
you
yes,
need to consult a doctor, and when a doctor will prescribe you, then only you should take this psychological medicine, psychological drugs, psychotic drugs, basically, because they are really addictive and they can harm you if taken in wrong doses or wrong amount or wrong medicine.
yes. You can take even I'm an example of this. Day before yesterday, I took medicine without asking my doctor or
Oh,
without asking my dad. So my dad is also a doctor. So I didn't ask him or ask my doctor. I took the sleeping pill. For after that, for from last 2 days, I'm having hangover. So suppose if you are not like before also I used to eat that medicine like 1 month back, but
mm-hmm.
after 1 month I had this medicine, and you can see the result that after 2 days I'm still in hangover, and
Oh,
that's not good. People will think you are going crazy. Believe me, I've seen people giving me tones.
okay.
So
And one point
okay,
I want to discuss here is that Dr. Alok Kumar's father is a doctor, okay, and he got his treatment here. Okay, his father helped him, but it cannot be the case with everyone. So please, and you
yes,
may take some wrong steps because you are not aware. You like it can be anything. So please don't take medicines without any sort of prescription. Like it's very
yes,
important.
yes, Anmol, you're 100% correct. Please don't take medicine. I gave you example of mine that I took without asking, and still it hurts me. So there are a lot of medicine for anxiety, and there is anti-anxiety and antidepressant, and there's a sleeping pills. There are a lot of pills. So unless and until you are not prescribed, don't take. So look, one thing I want to tell you people is insomnia is one of the main reasons people go to doctor in bipolar disorder. It's like when I went to see doctor before that, I had 2 weeks without sleeping properly.
Oh.
And that's too much. My teachers used to take me for walk and all. So it's like that. That's why me and Anmol, that's why we both keep repeating these things. We don't try medicine without asking the doctor.
Exactly.
And you must listen to them. We are no one to. We are just giving example or trying to help you people. We are not professional. Even me, I'm doctor, but I'm a dentist. And dentists have no role inside your mind.
Yeah.
So even Anmol is studying. When he will complete, then only he can give you therapy,
Exactly.
So we both are doing a social help, nothing else.
Yeah, we are just trying to educate you guys. That's it.
Yes. How much we know, we are telling you. And I know even after so much work, we might be in some part or some way. For that, I know in behalf of Anmol, I'm not saying sorry because we are not perfect like everyone. So please listen to your doctor first.
Exactly. Like whenever you feel like having professional help, seek for professional help.
Yeah. Yes, you should go because if there is saying if in our medical science, if you suppose there is a 50 rupees work on your tooth and you will leave the tooth like that only. So when the tooth will be gone, it's fine. But when the tooth will be gone, you have to implant a 50,000 teeth. When you feel like there is something wrong, there's something happening, you should go and visit doctor as soon as possible.
Yeah.
Because unless and until you won't go, you won't be cured. I know there is no cure, but you can be better. There are so many celebrities. There are so many people, doctors, have suffered from bipolar disorder and they become so great in this world.
Yeah.
So never, even any disorder, any mental health, not only bipolar disorder. No, I'm speaking on that because people who think they will and they can, they do.
Yep, true. And talking about bipolar, bipolar is not at all 100% curable. We can just manage to live with it, and we are seeing Dr. Alok. He is enjoying his life, and yeah, he is also in depressive phases. He is also in manic phases, but then also he is living with that.
Yes.
So, Dr. Alok, we can categorize medicines like in 4 categories, like antipsychotic, antidepressant, anti-anxiety, and sleeping pills, right?
Sleeping, yes.
Okay. In antipsychotic, lithium comes. Okay, lithium helps you in your mania.
Lithium before like in past, lithium was used for both, like antidepressant and anti-anxiety. So now there are more better ways of. Now there are a lot of better medicines. So lithium is there just for depression. Okay, and there are other medicines.
Lithium is for mania, right?
Yeah. Sorry. That's my fault. Sorry. So lithium is for many phase, and people are working on. They find a better cure. But unless let me tell you some facts. Lithium is the first medicine to be discovered for mental health, and still it is in use. So if you are bipolar and you have diagnosis, you are diagnosed with a doctor that you are bipolar, then you should go for some test like lithium in your body because it might harm your kidney and liver.
Yeah.
So
I don't know about liver, but it is said that it affects
Yeah.
kidney and thyroid gland.
Yeah. Liver is also affected because all maximum digestion is on liver only, na. So that's why.
True.
And I am a fatty liver patient.
Mm-hmm.
I have grade 2 fatty liver.
Okay.
So I have to check everything. So that's why these things I keep in mind, and I'm eating medicines like before on time, and once or twice in a month. Sometimes I forget, but that's a common thing. But don't try to forget it.
Yeah.
If you are if one more thing I want to tell is that if you love drink alcohol, so don't mix drugs with alcohol.
Yeah.
If you had drug, if you had your alcohol, even after that, wait for a few hours and just eat your medicine. Don't leave without medicine. Don't sleep without medicine. I'm saying. Sorry, I'm doing so many mistakes. Sorry.
Okay. Hey, I want to know one thing, that what will happen if you just stop taking medicine?
That's a very good question, Anmol. I have been in that phase also. I stopped taking pills. I used to I was insomniac. Okay. First of all, then I was in so much depression that for whole year I blocked myself. Isolated myself for 1 year. That I don't want to go anywhere.
Oh my God.
I don't want to meet anybody. I stopped taking calls also.
Okay.
So this is a thing which happened to me.
And here I will again say that Dr. he had help at his home, like his father is a doctor. So that's why we can see him here, and it cannot be the case with everyone. So please take it seriously.
Yes, even that was my mistake. I regret because my 1 year passed, and should try to be better as you can. Okay.
Yeah, your health, it's cool. Okay.
Health matter.
Exactly.
And one thing, and you matter. First of all, you matter. Even nobody gives you. After that also, you matter.
Yeah.
Give your attention to yourself. Be your best friend. I'm my best friend. That's why, first of all, I wish myself on my birthday. So I know it's quite a weird thing, but I do because I think myself as my best friend. I've seen people going away from me because of my behavior, and even my intentions were right. So I've seen people leaving me in between. That's why I say, be your best friend. Even now, if I think about those things, my eyes become watery. So it's a lot of pain. People won't understand you unless and until they go through the same thing you are having.
Yeah, see, it's very difficult to understand bipolar. Even I'm talking with Dr. Alok regularly, but then also it's really, I would never be able to understand what he is going through until and unless I myself go through these sort of things.
Yes. No, I wish Anmol won't go through all those things. It's very bad. First of all. And I never wish anybody to get ill like that, because there are so many, even there are family breakdown. There are so much in India and in outer place also. Now, bipolar disorder is very common in India, but the thing is, people don't believe in doctor. They don't go to visit a doctor, or they don't even go for therapy. They ask what to do. Therapy helps a lot. Sorry, it's the later topic, but still I'm speaking just because I want to tell you people that things are there. Always there are a lot of people to help you out. You can find a lot of people who can help you, who will help you.
Of course. So till now we discussed psychiatrist role, and since we talked about therapy, let's talk about the psychologist role. And psychologist is a person who is usually he or she usually do his or her specialization in therapy, counseling, guidance, and these things. Okay, and yeah, one more thing. When we talk about psychotherapy, which is also known as talk therapy, it can be given by both psychiatrist and
Yeah.
psychologist.
Yes, I have gone through both. I had visited psychologists and psychotherapists. So they both to ask you, and yes, talk therapy helps a lot. Even when you talk to somebody, you talk to your buddy, talk to your parent if you are comfortable. Then those talks is very important, because I know I've seen people who will never going to understand you, but that's why the therapists are there, and they will listen you very peacefully, very calmly. They know that you are nothing wrong. They treat you like any other person. That's why you should visit psychologist or psychotherapist, because they think their patient, they know what they are dealing with. They will give you respect. They will give you time. There is no rush over there. It might cost you some bucks, but believe me, guys.
Like they will try to understand you and they will try to help you out from whatever you are going through.
Yes.
And like it was about talk therapy. In talk therapy, usually a person speaks and the psychologist or the psychiatrist listens. And in the conversation, there are many things, many activities goes on. And what the basic aim of talk therapy is to take out all the things from the client. Okay, take out whatever he had in his mind and these sort of things.
Yes.
Right? Yeah.
You know, I know, Anmol. Actually, there's a small story which came into my mind.
Sure.
Like, I want to tell you, please guys, don't take it otherwise. So actually, I was in Kanpur and I was so disturbed. So my friends took me to GSM, the medical college in Kanpur. So when I met with psychotherapist, she was a lady, you know. What happened to you? I said, I told her a lot of things, and then after I said that, ma'am, I can't feel kiss. Like I can't feel kisses. Like I have no feeling about those things. She was like, what the hell are you talking about?
Just a second. You what you said? You don't feel?
Yeah. Even now, it's very hard for me. I can't feel. No, before I used to feel. No.
Feel what? Emotions?
Emotions, yeah.
Okay.
Those romantic emotions.
Oh, okay.
So the teacher, suppose you're going to a lady doctor and ask telling these things, you will be shy, sir, obviously. But I told so frankly, she was like, what the hell? So it was very funny. And that on the face she made was funny. My friends were laughing so hardly now. So that was funny. But yeah, I told the truth. Look, that is a good thing. You should never hide anything from your doctor.
Yeah, it's equally important.
Yeah, they will secure everything what you told them within themselves. They are not going to tell a single thing without asking your permission to anybody.
Yeah, like see, so confidentiality is very much important in our field, and we are very much confidential. We don't share anything until and unless if we see there is a threat, like if you can harm yourself or you can harm others or some sort of police thing, these kind of things, and only that kind of things we need to share. Otherwise, we keep your things with us only. We are not here to share anything. It's all confidential. It's all secured within us, within the counselor and the client. It's all within both of them only.
Yes.
Good. Okay. Next. Yeah.
Yeah. That's up.
Yeah. Next. therapy is CBT, cognitive behavioral therapy, and it is very common these days, and it's working good. Okay, so what CBT
Yes.
do is CBT focuses on your thoughts, feelings, beliefs, and behaviors. So what they do, they try to extract the negative thoughts, the negative feelings, the negative beliefs from whatever thoughts you are having, from whatever feelings you are having, and they try to tell you that this is negative and this is positive, and they try to modify them. They try to help them in order to know them better, to acknowledge them, and they try to make some sort of changes in your behavior so that you are more likely to be acceptable by the society, by your own people. And basically CBT is very helpful. Like, see, whatever you talked about till now, like talk therapy and CBT, they focus on the individual, right?
Yes. Yes.
Now we are yeah
Yes, Anmol, continue.
now we are going to talk about a therapy which is known as family therapy.
Yes. Anmol, let me explain a bit of my experience.
Sure.
Okay.
With
So,
respect to family therapy, right?
yeah. No, not family therapy. Before what we said, cognitive theory.
Yeah, CBT, cognitive
Okay.
behavioral therapy.
Okay, cognitive behavior theory. Actually, I've gone through therapy first. So the ma'am used to ask me to write 10 negative points and 10 positive points in a day, which I came across over. And she asked me to write all the feelings, or the movement after half an hour, 1 hour, how I'm feeling currently. Okay. So there are a lot of things she asked me to do. Then she asked me to count opposite side now from 100 to 1. There are a lot of things she did in cognitive therapy. I've gone through it, and yes, it helped. Because before that I was not able to sleep. I just told you that I isolated myself. Then after that, I was getting better, and I used to get some sleep.
And you used to get
sleep,
yeah.
sleeping. Yes, sleep. Before that, it's not very hard for me to sleep.
So therapies help you in many ways.
Yes.
Like, if you have any sort of problem, go and seek for therapy. Like, they help you like anything. And there are many therapies for problems. Each and every problem, there is a therapy.
Yes. Everything, not only bipolar, but there are all the mental disorder. There is therapy, and therapy is very much important in life, because they are something who can be your best buddy.
Yeah.
Without leaking your secret.
That's 100% true.
Yes.
Cool. So, let's talk about family therapy now. So,
yeah.
Family therapy is done to help family members to improve communication, solve family problems, understand and handle family situation, and create a better functioning home environment. See, family therapy is very much important because, like, the person, the victim who is suffering from some sort of mental disorder or mental illness, see, your family is the first one who gonna support you, and
yes.
they can support you only when they know what's the thing going with you.
That's what is going through you, what you are going through.
Exactly.
So that's why you need money and all lot of things, but it's not about money only. It's about all the things, because you need support. You can't do without your family. Just like tell your family and yourself also. If you're with yourself, you are with everybody.
Like, whenever I used to interact with people, and when they have these sort of problems, I always recommend them to have some sort of support group, okay, which will help you. Like, it can be anyone, like it can include anyone, like your family, your friends, your colleagues, whoever.
Yes,
you should have
whosoever, even strangers. And believe me, strangers also help you sometimes. Me and Anmol were not friends, but we made on some online platform, and now we are recording. You can see this.
Yeah, now we are collaborating.
Yes, exactly. We never met.
Yeah, we never met personally.
We are, yeah, exactly. No, we have not seen each other's face also in reality.
Yeah,
Only photos.
Yeah, only through photos and video calls.
Yeah. So not even video call, man. Never, we never had video call.
We had one.
Hey, we had. Oh,
yeah.
Yes, yeah, maybe. Okay. Memory is getting weaker.
Yeah, like.
So family therapy is done.
Yeah.
And my doctor will ask your family. Even doctor will ask your family to come visit, because they got a lot of information from your family. So how are you doing? How much change you have seen? These and these things, a lot of things are there.
Yeah. So, like, Dr. Alok, what was your experience with family therapy? Like not exactly yours, but your family. Like
family. Look, I have been to 4 doctors yet. So first doctor was in Kanpur, and he was very good. Like, I will always say that he is really a good doctor, because his meds and everything was very good. Like, I can feel better in myself. I used to, before that I was so depressed, and after taking his medicines and all, talking to him, make me smile. Was a very good doctor. I used to smile always in classroom or in college. So that once or twice my family went over there also. So they talked, and my dad, he never have leaked that any information I asked him to hide.
Wow, yeah, so, it's very important for us.
Yeah. Second therapy was I went to a therapist, and she was also very good. To be truth, she was very good, but she told my parents certain things which I never wanted them. Never I wanted to, that they will go through. Those were my private moments. Like, I drink, I smoke, but she told my dad and mom that I drink and smoke, and I got so much upset. I left her. Okay. So after that, I came home. Then third doctor is a local one, but he is not giving time to any patient because of corona. Okay. I've seen him. He just got right medicine and nothing else. No therapy, nothing. That's why I left him. And my fourth doctor is in Ranchi, if you know Ranchi. It's Jharkhand's capital. India's Jharkhand capital. So he's good. He's focusing on medicine also, but we have therapy sometimes. That's our past.
Cool. So here I want to say one thing, that like, you will have good experiences with your counselor, your help, like professional person, and you will also have bad experiences. Okay.
Yes, exactly. No one, look, yes, Anmol, you have explained vocal. No one is 100% good. No one is 100% bad.
Yeah.
Maybe there was maybe she should have said, because my parents doubt it, because of my parent doubt that I smoke or I didn't.
Yeah.
And there are a lot of reasons, no?
Yep.
So maybe they have said that I need to know by this and that. That's why they have revealed. So it's fine. I was angry on her, but now I'm letting it go. No use.
So yeah, like, always seek for professional help whenever you need, and you will have good experiences. You will have bad experiences too, because it's life. Like, you won't be like life is never a straight line. It is always ups and downs. There are ups and downs, and you will have positive experiences also. You have negative experiences also. But the thing is that you should move on. You should go on. You should not stop yourself And like Dr. Alok is right now, he is seeking for the fourth doctor, right?
Yes. One more thing, if you guys want, you can follow me on Insta.
Okay, like if you want to ask anything with respect to bipolar, I will mention his Instagram in the
Yeah,
bio.
Bipolar Man is on this podcast only.
Yeah.
Only in podcast. And my Instagram is uk.poetry or uk ono. Okay, so follow any one. You'll get the second one also. I write poems also, and I do photograph.
Cool.
So Anmol,
so let's end this session, and
we will be back with third session. Anmol, thank you so much for calling me again, and hope you all have a wonderful Merry Christmas.
Yeah, Merry Christmas. Today is 20th December.
Yeah.
Merry Christmas to all.